of all, I would like to thank our Moorfields colleagues for hosting this first hybrid event today. And I would hand over to Andrew. Yeah.
Thanks, Rebecca. Good morning, everybody. My name's Andrew Tyler, and I'm the Associate Director of Performance and Information here at Moorfields. I'd just like to extend a very warm welcome to everyone who's been able to join us in person today, and also everybody online as well. I'm delighted that Moorfields has been invited to host this first hybrid event. For quite a few years now, it's been just a Teams-only setup. So as Ramiko said, it's the first time we've tried this. My fingers are crossed for all our tech and our IT, so please join me in that. This is the second time that Moorfields has hosted an AphA event, which hopefully reflects some of our commitment to that organisation. Last year, we've taken the view that we should have a corporate membership approach as well to AphA membership, which I think is a positive move on our part, and also hopefully send a message to other trusts that this is the thing to do, and hopefully to all of those that are involved in our organisation as well. I think we took that view largely given the amount of work that's going on in our professional space at the moment. Clearly, I think the national competency framework is having an impact on the way we feel and think about the work that we do. So this opportunity really, I think, both on site and on screen, gives us a real good opportunity to network, to get advice, to test some ideas, and more importantly, I think just exchange some more stories about the things that we do. I think it's very important that professionally we start to hold hands, perhaps in a better way than maybe we have done in the past, just to make sure we've all got some security and some support across all the different organisations. A special thank you up front to all of our speakers who are here today. I think we all know it's not the easiest thing in the world to put a presentation together. It takes time, takes effort. We thank you very much to everybody that's going to contribute this morning. And that's the primary reason why we're here today. So I'm going to shut up. I'm going to hand back to Ramiko. I think he's going to hand over to Catherine, just in terms about in terms of a bit of housekeeping for those that are on site.
Thank you, Andrew. Really kind. And Catherine from Moorfields, she's also the Deputy Branch Lead for North Central London. She will take us through the housekeeping.
Site, so there is no fire drill planned this morning. So if the fire alarm does go off, it's an intermittent one. To be aware, if it's continuous, we need to evacuate. The fire exits are both doors over there. Door over there goes to the main hospital. Here you go straight down the stairs to the main, right the way down to the reception, and onto the main road and turn right. But thank you very much. The toilets again are outside, and one of the P&I team, unfortunately they're behind a swipe card door. We use to access. And again, thank you for coming.
So for the online joiners, the slide, can we, yes, yeah, next week. Yeah, the red cards.
And that's it, thank you. Yeah. So yeah, just for those online, and it's really actually with if you're members question, should we very much hand up online. You've got someone with question hand up into the teams. Great to share on social media, either on Twitter or LinkedIn. Spread the word about what AphA does, especially in London. Those online, if you could stay on mute and not speaking, it's really great if you can have your camera on. And when you do, if you do have a question to speak, you could just introduce. You can introduce. Actually, you can all introduce yourselves in the area in the chat area. It'd be really good as well. So that's it from me.
Okay, thank you. Thanks, Catherine. So we'll go through. There will be a slide that will be shared. You know all your deputy branch leads are in your area, and just to go through the updates on what's going on at the London branch. So we are by far the largest branch in the country for AphA. as you can see, we have 181 members, but this does not include those who's currently on the process of registration. We have quite a big corporate membership joining us in the last month or so. Those who went through the process, we have Rising St. Thomas's, welcome, the North Central London RCB, and Central and North West London, which is Foundation Trust. And I'm aware of several others who are joining us shortly. Next. Yeah, that one's here. Okay, so what happened since last meeting? On the 6th of February, we had the London Skills Development Network Conference. Many of you were there. You can see the photo there. And we've been featured in the latest AphA magazine. And we talked about this as well there. This had real great trigger to entice people to join on a corporate level. The 22nd of February, I think had a webinar on the CPG and culture and data analytics professionals. And in March, I wasn't able to attend, but there was a digital health rewired. And I'm not quite sure if Ruth has joined us. Maybe not. If she can later on, maybe she'll give us an update. She usually does on what's going on at the executive level. Okay, so shall we go on to our speakers? We have 4 speakers today. And over to Andrew for introducing Stephen.
Just quick bit of housekeeping internally.
Yeah. Oh, yes. Yeah.
You might have noticed, you might have heard the rattle. There are teas and coffees. It's a bit late, so apologies for that. If you want to make your ways, maybe one at a time, in an orderly fashion, coffee at the back by Chris. But we'll leave you to get one at a time or whatever, and I'll introduce Stephen as we go. Yeah, our first presentation is from Stephen. Stephen Chin's our performance reporting manager here at Moorfields, and it's going to take us through a little bit of work that he's done over the last 6 to 9 months to look at how we get best use of SPC. We probably came to the party a little bit late with SPC. It's something we've had really running in trust for about 18 months now, but it's been extremely well received. So we've done a lot of work around looking at how we might get better use out of it, particularly on our reporting tool, which we have each. Makes sense. I'm sure many of you are familiar with. I'm sure I don't need to explain much about SPC. I'm sure most people are aware of the Making Data Count program. Stephen's just going to give a little bit of background as to how we decided to make that move to SPC and the work we've done around it. So, Stephen, over to you.
Thanks. Good opportunity. It's the first presentation I've done personally for quite a long time, seen on the Teams screen. So, so welcome all of you, and thank you for the introduction. So, yes, my name is Stephen Chin. I am a performance reporting manager at Moorfields Hospital, and I'm going through our journey of how we've changed the way that we're presenting it. So, moving from what's traditional, this sort of traditional board reg reporting over to what is an SPC methodology. But then from this, how we've incorporated this as part of our business intelligence team. So, okay. So, the reporting should be about helping our users through understanding, interpreting, reacting to that data, that language of data, and the questions that can we sort of provide. But one of the things that we always try to do with that reporting too is to try and identify those business connections where there's need attention. So questions such as, where do I need to focus? What are my biggest concerns? When should I be investigating further? Are there any insights that need to be made about? But all of which can be just summed up as touch-tone points. One thing we're saying is to try and cover every base, every figure, every assurance. Many NHS reports in some kinds come out. Very pretty. Lots of figures, lots of colours, but Is it telling me where I'm doing? Is it telling me where those mistakes are? I'm sure that it's helping some, but it's not necessarily clear what area should be focused on. So what I'm going to be covering today is where we've come from, our traditional grant reporting, how we've migrated over to our SPC methodology, using the methodology making data count, which I'm sure some of you may be aware of. We can go over that, and then how we've used that, how we've turned that into a dynamic sensitivity. So I mean, very briefly with our integrated performance report, it all started in 2016 when our then chief executive decided came to the point that every director was producing their own reports. We wanted one consolidated report together. So we came to us asking integrated reports. So April 2017, we published our first version. Really just breaking it down. I mean, first version, still lots of things, but big things. This is what's going on recently. This is what's 13-month trend. But more importantly, the references, the RGM standards. We did put together a bit of a summary. We were asked to put together to try and aggregate an aggregate. We very quickly got our idea. Picture, but it wasn't split out a sequence. But this was the big thing from it. But where an action was not in the threshold, we would get them to remedial action plan on that. So this was what the problem was, what action you're taking, and who was responsible to this. And this was a great way of capturing narratives to what needed to be done. Over the years, it's evolved. Our last version of this iteration we produced in March 2023. Still the same, similar figures, a lot less of them, but again, it's still driven very much by that reg status. That, I suppose, what they can 2-point comparison, comparing what's going on now with what happened in the past, definitely in the last period. And again, the remedial action plans, they haven't changed all that much. There's some rudimentary SPC, but as I said, the good about it was to build. We mentioned Tuesday covered everything. We were great at capturing all the conclusions and those actions, and it was very well received by those external, by everyone that read it, internal and external. But there were some problems with it. I mean, probably having a narrative which is always talking about missions and actions, it comes across to be admin. Other than executive summary, there was no celebration. There were other things as well which we picked up, which was when you had a metric which was in and out of performance. If you're writing a remedial action plan every month, you would often lose messages. And again, that 2-point comparison, you're looking at what happened now, not looking at how that could be in context at this long past. And the other one is that because things were green, didn't mean things were good. It's because it could be hiding in a deteriorating position. But those last few I'll come on to in a moment. But the ugly was that while we managed to change the board report, it was very, very hard to get to the division lunch. So in Moorfield, we have over a dozen sites, active sites. Each of those sites have a number of subspecialties. Bringing it from our divisional directors was I wanted to know every metric and every month for every site and service. And that was a sticky. We tried to convert them, but it was unsuccessful, and as a result, getting just like this. Very much similar to the first page. Lots of pretty fancy things. A comfort blanket, which is they were quite happy with it. It gave them everything they needed to know, but was it actually something that was driving those decisions? Not so bad. Right.
So I've let that previous coup was
Previous coup and the food. But so we made the transition to Triangle SPC. Now, we'll talk very briefly about making data count because I could go on forever, but actually the making data count team led by Sam Bryan, you could do this faster. But in short, it's an NHS England initiative to try and, well, they're looking to try and change the way in which trust board reporting, boards report. It can be scaled, goes down to the. The big thing about it was trying to migrate from a grant-based chain, looking at 2 comparison to looking at trends from SPC and creating a language to which people can relate to with SPC is which can be used by lots of trust using it, and our trigger point was they went to our board in late 2022, presented to them the methodology, they agreed with it, and from April 23 onwards, we went on with it. We were given permission to get as such. A very, very quick one with this. What it does is it tries to drive the idea of looking for variation where something has changed and different. Something in their terminology special variation. This is going to be where a value is exception. A value is close to being exception for a small period of time, or where you have values which are running above or below an average or consent values. Things that are out of the norm. And those are the things that we're trying to. And when these things came up, that's what you would investigate. You wouldn't investigate norms, you investigate signals. As I said, there's a very common language to it, of orange for concerns, green and loose for improvements, showing us where there's variation going up, going down, and where it's staying about the same. But also an element of assurance. Are you passing that metric? Are you failing that metric? As I said, I could go on and on about it. I'm not going to because I have 15 minutes. So there is it's on the NHSB site. They have presentations, templates, even a 10-step program to actually do. So it's very much work. It's something which I think would be a very presentation. I mean, it's a very quick one. Good example of graph. Look at this. The sea of green, everything's great. It's this 90% target. Look at the absolute SPC chart though. It can hide the decline and work show that it's targeting works. Similarly, we have a target here of 80%, and this is terrible. Fire everywhere. But let's put that into the SPC chart. So fantastic improvements. It's that target. Not quite there yet, but it's well reduced so much. So this is what we turned it into, the new IPR. So our detail page, it removes places about reg rating that you have. We've measured activity on assurance, variation, picking out what we need to be focused on. And we kept the narrative in. Unlike the remedial action plans where charts were only produced the things where which were negative, this gives them the opportunity to promote those people stories, to celebrate successes. But where something isn't a problem, as before, have an issue, what's being taken, and who was responsible. One thing we did do with this, and we've from which trust we took that we sold this, borrowed this on, was we created a summary page, which which very quickly highlighted to you what metrics were failing, which ones were in concern, and also which ones were shown. As the report developed, we did receive feedback from our staff and from various stakeholders to say, okay, this does show you everything, but I just really wanted to focus on in what are the problems. So from this, we then created an even more concise view of what's going. Tell me what's going. Tell me what the concerns are. Tell me what to celebrate. Tell me. We had a couple of pages which obviously isn't methodology, which just quickly explain what was going on in the reports. And one thing we're working towards, we took this, we met with a number of our patient forum people in an eye hospital, many of them are partially sighted, and there's one of our unsighted governors would say, how can I comprehend what an SPC chart looks like if I don't know what a chart is like? So we had to create an accessible way of being able to that. And although it's still in development, it was a case of putting all the figures in place. But again, we're creating that common language that makes it to make it accessible. And then quickly, the divisional reports, we managed to get into a similar format. Although the divisional reports we only produced at the divisional level, again, following that same formatting and noting when issues. I mean, moving forward very quickly, we are trying to still continue to promote different stories. I mean, you think people want to celebrate these, but people want to have the people don't want to talk about it. So next time it fails and so on. So using again methodology, we improve the things. We're looking at the ways in which we're to break up the process, SPC process, and what was to measure from. And previously, we just looked at pre-COVID, post-COVID, but now we're into whether it's the post-COVID world is how do things. And finally, one thing we did realise was that sometimes it kind of focused on KPIs weren't really KPIs. People didn't want to. There could be a sort of reluctance to try and improve them. And if you're not trying to improve them, then are they really key? So it's an ongoing review to try and it's really highlighting it really puts into focus what should be, as opposed to just making it. Now, one thing the divisional report, as I said, is we reduced the divisional report as a just for one division, otherwise we would have the document 1,000. So we had to create a way in which the divisions be able to look at business science and service. So to do this, we developed a business intelligence tool, ClickSense, which in itself not only allowed the data to be looked at outside and service needs, also just generally sort of situation and start that analysis. I can't say credit for some of the objects within the ClickDoc. So the SBC objects in ClickSense were developed by Dale Wright and Morgan. It's fantastic piece of things. Anybody could use it in to download. So that's part of it. Well, this is where people get technically wrong. So I'm going to migrate over to my screen. So it's a very quick demonstration of what this can do. Right, so this is sort of one of the front pages that we have. So take too long to load. So what we have is a number of what we have in here is every metric that we have to report on. The in this case, I selected future cancellation rates. I can basically every SPC, it's all dynamic, and so we can sort of bring that all together. The SPC chart itself, by default, we've still got it set as the pre-COVID period, during COVID period, post-COVID period. But if we wanted to, we could very quickly reset the process rates. We can turn them off, change it to what date there goes. So there's the SPC process from starting from April 2022 to default. But as an example of how we would use this data to drill down and analyse, I'm just going to quickly select last few years of data. And I'm also going to start to the South divisions, some data for them, as an example. Another thing we can also do actually is as well. By default, the metric would also revert to the target and set it, but this one doesn't have a target. What we'll do set. So if there is an assurance benchmark that we wanted to reach, we could say also gives a few more icons to look at as well. So again, following that making data count methodology, sort of highlighting where there was an improvement, there is an improvement, also those exceptional concerns that appeared there. So, just to say as well, within this is looking at that theatre performance. We've also got all the other ones behind it. So we have a numerator, the number of cancellations, denominator, the number of bookings, and what I call the anti-numerator, which is effectively the denominator minus the numerator. Great for things such as A&E performance, where we could tell them breaches. So if I go here, we have a summary table, which hopefully takes too long to calculate. But this sort of works as a way of looking at data at a more granular. Well, at the moment, we've just got Excel division selected. And so here I have the data broken down by our subspecialties, which very quickly at a glance. So very quickly at a glance, you can see which areas are, if there are no trends associated with any of these areas, we've got which metrics are passing and which ones are not looking particularly good or failing. But one thing as well with this as well is that this sort of has to be viewed in sort of context, for example, business with multiple operations. So it's not having a huge effect on the overall figure. So one way we look at what's the biggest problem areas to look at is we can look at it as sort of a Pareto view. So this is just telling you the number of cancellations by service, just telling you these top four. This top four represents 80% of the cancellations. So I'm just going to select Diploma. But then it's from here, and again, split it down by site. And I can see St George's Hospital is doing it, is where most of its cancellations reside. And that table. Very quick fire. So St George's is the one that's not meeting that arbitrary target just set. Although Croydon is actually showing an improvement to the operations they're having. So again, this is where we would start that analysis, start to see where the issues are and where those improvements exist. So that's one more slide, I think. That's the clock going. Hang on. Okay, I get it back. So I've got unshare.
I'm sure.
Oh, there you go. So just because this is the contingency plan. Yeah, so yeah, the tool is being used very much in meetings. It's actually not just for preparation, but we've started to be used in live meetings as well. To understand this, yeah, we understand. Yeah, they asked a question, and this is given extra thing. The big thing is also that this inspires some of our non-analysts users to start using it as well. Our quality and safety team are becoming really savvy at producing it. And this move is taking a bit of over for the analytical teams to do this. And so we are looking to produce that well for by fashion. Yeah, but the big one as well is that at the moment that summary table is isolated to this application. Point that out to other applications. So that is a very whistle-stop tour of what we've been doing over the last year or two. So with that, can we conclude with thank you and any questions or comments?
In the chat.
There's one question from the chat from Alan ECLH. When this is quite a challenging question. When you have identified a declining trend in a metric, how do you then approach the causal analysis to expose the factors contributing to the decline? We can probably spend hours talking about this, but maybe you can give us an example if there is one.
Certainly with the board reporting, what we would do is we produce a first draft of that initial summary of what's going on. And one thing we have realised is that sometimes you can't just say here's a report, write us a narrative and hope for the best. We've started to put in cannings into our various meetings to actually discuss that performance in more detail and talk through them. Well, as I may know what's going on the ground floor. We always numbers for data. We don't help first effectively. So we would have those regular meetings with those data leads to try and understand those issues. Quite often we'll have those conversations. It's like, I don't know the answer to that question. I'll either go to another dashboard to see if I can find an answer from that. It's a standard chart I'll put through an SPT, or I'll phone up the person who will. And it becomes a live interaction. And that at the moment seems to be working for some areas. The areas where it doesn't work for are quite simply where people don't want to talk to us. They're just quite happy there. They will see the number, they're told that there is an issue. But this comes back to the thing I was saying earlier about, is it a KPI? I mean, to me, a key performance indicator is something that if you didn't do it, if you did not achieve it, someone's going to get into trouble. So if it's not something which is deemed that critical, is it really a KPI? So that's going as part of that review, as part of that review that we're doing to work out what we should be in. But I suppose that's the simplest way I can explain that question. As Nika said, there's all sorts of different ways you could analyse that data. But having that data, knowing those connections, knowing that triangulation is is basically key. Otherwise, you sort of start from scratch.
Maybe we can all kind of share our experiences and how we went about trying to analyze. But if I have one example where in our trust as well, and I was talking about it, but yeah, maybe we can have sort of a platform where or a forum where we can share those ideas and experiences. Is there any questions from the floor?
Sorry, do you want to go first?
Slightly faster.
Sure. I'm just wondering, how did you manage the culture shift? Because there's going to be a lot of resistance, especially at board reporting. So we obviously serve not only our BI colleagues, but also operational and financial colleagues. So,
Can you first introduce yourself?
oh, sorry, Sing Fan, GSTT, data analyst. So I was just wondering, how did you manage the culture shift from there? And also what education was involved during that process? Because obviously it wouldn't have been just straight from board reporting to a dashboard where they can just actively use the dashboard itself.
Well, thank you for your question, and that's a very good one. Say managed it is, I think, the word better word than managing. It is still a transition, but it's so the first one was so start the making data counting came in. Board said, yeah, okay, we want to go down to that. So at least we had the board buy. You have to have that high executive bias to that methodology that they agreed this was the way forward. But yes, I suppose the answer to that question is actually answered a little bit in my last one, which was it's having that constant communication and liaison with users. There is some resistance in some places, such as you still work on that what was that 2-point comparison, that red or amber. If your target's 90% and you're 89.1, then as far as they're concerned, you fail, just panic, it's terrible, change everything. But it's where so some people will still have that mentality, and that's why it's still a managing process. But other people we've spoken to, we've sat them down, we've gone through methodology, we've actually put some of them have actually even done those making data count training courses as well. Because as I said, the making data count team would be able to sell this far better than I would, but they talk about it being, you know, this is what variation is, this shows those figures go up and down. But I suppose also, I think finally as well, is that if you've got a metric, which is you have to achieve it you have to get 90% every single month, then there's a status in there that says that metric is flip-flopping, it's almost on that target. Is that good enough? Should you not be at the sort of aiming or aspiring to be a passing metric? And I suppose that's one of those challenges is, again, if it's KPI, if it's that important to be passed all the time, you should be aiming to have that metric as a passing metric, and if they're happy to have it as a flip-flop metric, it's really not that important. It's nothing like business. And I suppose when you put it in, we've put that in that language to some people, and there may be a lot of light bulb. I suppose I can say there are examples, as I said, when we've shown this to people, especially when people have come to us with their own data, produced it their own way, something chart. And then we present that same data in that SPC format, and you can see the room light up sometimes. And I'm not, without exaggeration, it's a bit appalling, but it suddenly becomes clear what's being measured, what those trends, what's going on. So yeah, I suppose, does that answer sort of the question? But it is an ongoing journey to do that. And I don't think, in fact, we talk about data literacy, that data. Not all people are going to be able to speak that language, but it's about creating that translation way of trying to bridge that gap between that data language and what they understand.
Thank you.
Interest of time, Nina, after you.
Yeah, it was kind of similar, really. Like, do you think you went over the board, or do they tend to refer back to like one pager that says everything? I mean, I noticed that you kind of try to get around that by picking out the particular areas that you feel are most important. And then the other thing is like not necessarily a bad thing, but do you feel like you're kind of making more work for yourself? Because in the past, it would have just shown the figure and it would have been green and everything was okay. And then when you start looking at the data underlying, it has really weird stuff. And
Do you feel like you can just leave that in the report, or do you have to go in and sort of delve into it a little bit more before it's published?
No, thank you. I think it's with the last part of it, it's a bit of both. But one of the problems we've got at our board is that there are some trust boards sort of 2 or 3 months in arrears. We have to report ours a month. So there is often quite a very quick turn to get it out. So sometimes you don't get to do as much analysis. Right. So it's, I suppose it's added value. So it's you know that sometimes it's going to tell you what to do. And this is again where with the analytical teams, our analytical team, we are working with each analyst team has their own divisional analysts, has their own service analysts, and they're able to try and focus on those areas. They will always be looking at that data before they send out the division reports, for example, to pick out those problems. But again, it's about that communication. If you just say that, say, doesn't get the answer to it. It's but when you're actually starting to have those conversations, it's really do one or two things. I want to investigate this. Can you give me the detail, or it will that's important sort of I need to be focusing on things. So it is about because it's and it doesn't necessarily have that added value. But we found that it's been. So I think the biggest experience is and making sure we don't react to a single and looking better.
Thank you, Steve. I'm conscious of time, so we better move on. But just, I guess, a bit of an addendum to that answer. Stephen's been very modest. Yes, it's created an awful lot of extra work for himself with this process, but it's been really positive, good work. Because it's changed the way that we look at performance within the organisation. So we do get asked an awful lot more questions, and in fairness, a lot more pertinent questions as well. So it's focusing on the right things, I think, now in the business. But thank you, Stephen. That's been a really helpful run through, just to remind me how bad it used to be and how good it is now.
Thank you.
Takes us on to our next speaker, which is Gary Smith. Hopefully the presentation come through. Right.
Apologies.
So for that, for those online, we're just doing a quick bit of internal getting presentation from one place to another.
It's always right at the last moment you find these things. I thought it was already with you.
I will do that. People can grab their teas and coffee.
Well,
Yeah, tea and coffee might be a good idea. Can I just make a comment about SPT charts very quickly? In that, from my experience, one of the limitations of SPT charts, but possibly not only SPT charts, is the way it handles data sets with a small denominator, whereby because the denominator is so small, you can have one or maybe possibly two breaches. One or two breaches will affect the performance dramatically, and of course that's sort of reflected in the SPC chart and can be misleading when you're viewing it. So sometimes you do have to be careful and be mindful that your data set can be skewed quite dramatically sometimes if it is quite small, and it is affected by that. But there are other alternative charts to use in those circumstances, Stephen.
Yeah, I was going to. I mean, again, it's one thing that the Making Data team promotes is that they recognise that you can't stick everything into your standard time scale and SPC charts once again. But one recommendation they have for rare events is what they call the T chart, which looks at the gap between sectional events. So take an ever event or some nature like that. You would look at the number of days between a event and you'd plot that. And then what that chart would then do is it would highlight, are they becoming more frequent or are they increasing? But these are the conversations we're also starting to have with our operational teams, because that is quite an intermediate to advanced concept I mean, at the moment, they're just used to seeing a, if you count on down the y-axis, and this is the timescale on the x-axis. Moving them away from that style of chart is going to be a literacy challenge. But I think it's something that we're looking to do in the next year or so, and certainly something we're looking to create an opportunity. Thank you.
We also had Sam Riley making data come to our trust, or actually St George's and St Helens. It was St George's to do the presentation to the board, and we were invited to observe. You can see the board members kind of face light up when she was showing how SPC charts can make a difference in the way they view the numbers. So it's quite useful to have those and just have a similar down approach. There was a resistance of some of the executives who just couldn't stand SPCs. He was refusing to look at any SPC charts, but that thing's sort of the atmosphere. But then the problem was everyone started to ask for SPCs for everything. And that was.
You need to have an appropriate set of rules.
Yeah.
I know, but completely agree with those challenges. Not people just like colours, just like green and red. It's easy. So.
Apologies for this, everybody.
There's a comment from Tom around rare events, may use T charts.
Yes, Steve Gart's is going to confirm that.
Brilliant. So, thank you. Sorry for the delay on that, everyone. So, I'm Gary. So, I'm Gary's technical work for CACI. I look after healthcare in the location intelligence group, and this is my colleague Jamie.
Yeah, I'm Jamie. I work with the majority of councils in the communities and government team, and they license a lot of data from us. It's my role to help maximise the use of data through sharing best practices and use cases.
Let's go to the next slide. So, as mentioned, yeah, we work for CACI. We're a data company. So, our tagline is we do great things with data, basically, and we work across many different aspects. So, the first aspect that we're mostly going to be talking about today is we create data. So, we create segmentations that you can then obviously take away. It's all postcode related, or it might be even down to host, household, or individual level related, and that you can then obviously interrogate and understand more about the UK population. On top of that, we also design tools that help you that allow you to sort of interrogate that data. So we have our own GIS tool called Insight, which some of you may have heard of before, but it allows you to then just analyse that data, create reports, create maps, and then interrogate that data in a little bit more detail. And finally, we also have expert analysts in-house. So we have analysts in-house that basically using data all the time, running reports, and basically able to support you if there's anything you aren't sure about how you can achieve. We might be able to do that or collaborate with you to sort of help you achieve those issues. So the reason we're here today, as Jamie mentioned, obviously we work across many different areas looking after local authorities, but the reason we're here today is we have a partnership with NHS England. And so what that partnership means is that we're supplying a variety of our data sets to all ICBs in England completely free of charge for the ICBs. So that's good if you work at an ICB. If you don't work at an ICB and you want access to this data, let us know. We can help with that. We can support on that. And they're subsidised pricing basically for if you work for us, right? So things in line with NHS England already. But the reason we're here is obviously to talk about that partnership and what that actually means for you. So the reason this started was back in 2022, so a little while back when CCGs were becoming ICBs. And the idea was that we wanted to supply a variety of data to all the ICBs as they sort of got up and running. Things happened, it didn't quite happen as quickly as we hoped, but we are there now, and we're now supplying this data. And the idea obviously is to start helping you all share best practices between each other. Obviously, these meetings are fantastic for this, but we want to do that as well with the data that we supply. Also, as Jamie mentioned, we work across many different local authorities, so we can let you know which local authorities we're working with as well, and basically help you get access to that data. So the way that you actually access this data at the moment is through your CSU/Descro. So I know that they're supplying ICBs with a range of data at the moment. This is an extra data set that you can now get from the CSU/Descro. actually use it. So if you go to the next slide, Jaden. So what we're doing at the moment, we're doing presentations like this one. So we're meeting individual ICBs as and when we can to let them know that this data is available, and that's involving a lot of cold calling, a lot of hours, trying to meet as many people as possible, which is why meetings like this are much more effective because we get to meet a group of them at one time. And then, that, as mentioned, the deck is currently being shared through CSU Deskro. In the next 3 to 6 months, we actually have a webinar on the 2nd of May. So if anyone's interested in joining that after this, it goes into what we're going to cover today in a little bit more detail. We have Ming Tang, who's going to help introduce us and talk around obviously why we've done this and introduce the session. But we've got that on the 2nd of May. And then as we move forward, we also want to do best practice webinars as well, where we're going to be bringing different ICBs from across the country to talk about how they've actually been using the data and what effects they've actually seen. And then in 12 months' time, the idea is that the data will be on the federated data platform. So it'll be much easier to access once everyone's got obviously logins for that and is able to use that. They'll be able to go and access the data directly rather than having to go through the CSU/Deskro. Next slide, please, James. So how can this partnership actually support you? What's the data being used for at the moment? So we've got a few things up here that you can see. Improved population health management. So you can understand which services are being offered in certain areas and make sure that everyone's basically being accounted for and there aren't services being offered to only certain different groups of people. Similar with tackling health inequalities. By understanding the demographics of your local community, you can understand where you need to target services so that no one's being left out. You can start to investigate medical changes and non-medical factors. So the data that we're going to talk you through has a lot of information that isn't necessarily medical based. So one of the ICBs we're working with in West Yorkshire, there's basically every mile you move away from a certain town, life expectancy drops by a year, and they have no medical reason for that. So they want to start looking at other reasons as to why this might be the case, which our data can enable you to do. Then prioritising emergency responses. So we were speaking to Norfolk and Waveney recently, and their emergency response team basically wants to understand how they can do and react quicker to flood response. So what our data allows you to do is it allows you to understand how people respond to different methods of communication. So do you need to send people on boots on the ground to a certain town to help people obviously evacuate in the flood? Or could it be a text message? Could it be a phone call? Could it be an email? What message could you actually send out to make sure that people are listening? And then that can help you allocate boots on the ground in a more reasonable manner. And then finally, targeting smoking cessation and other prevention services. Obviously, you have information on who is smoking. What our data allows you to do is understand areas where people might become smokers in the future. So it might not be people that are already smoking, but you can get in before they actually start smoking, send the right services, the right messaging to those people that maybe prevents them from starting up a habit that you don't want to start in the future.
Amazing. So I'm going to now go through an overview of the data that's available to the ICBs. So we have 4 available. So we have our Acorn family data sets. These are at postcode household level, as well as ocean data as well. And the idea is that you can start to understand certain audiences, their social factors, their behaviours, whether that's digital engagement, how they like to shop, where they like to shop, their financial vulnerability, and all of that information will help you to then prioritise certain services, redesign certain services. Comms and engagement is a huge piece as well. So if you start to know who these people are, the needs that they have for certain services in each community, you can then start to be a bit more specific with how you speak to these people based really on their age and their lifestyles. And again, it's that consistent language across the ICBs. If they're all using the same data sets that we see here, you can then start to share reports and everyone start to again speak the same language. And then with the ocean data sets, it's a variety of attributes available around people's occupation, their interests, whether they're in a car, everything that an ICB or hospitals might not have that contextual information on. Our flagship product in especially local government is Acorn. So this is where you can then start to segment UK population by postcode. And you can then start to infer a variety of different things about their consumer behaviours, their financial vulnerability, and that's split across 7 group categories, 22 groups, and 65 types. So as you go from left to right in this chart here, you then become more granular in the insights that you hold of people that potentially do not attend people coming into A&E, frequent returns, people that are calling in. You can then understand who these people are. With the raw data, we supply a wealth of supporting material. One of them is the knowledge sheet. It has over 800 variables. These are just some key ones that are used within the public sector to understand income and affluence, digital social engagement, lifestyles and interests. One of our councils use it for understanding successful applicant foster carers, who these people are. It's a very strict process they have to go through. And then they can start to find similar people in their catchment that could be eligible. And then they can start to use the knowledge sheet to understand how to then engage with them. So one example was they did a whole advert on Sky TV. They knew that successful applicants more likely to sit down and watch Sky TV. And then we have the pen portraits available. So this is across categories, groups and types. And this is a UK view of what someone would look like if they fell into one of these categories, groups and types. So there's a top level overview of their core demographics, their financial situation, their lifestyles that they're leading, data that many ICBs might not have, especially around the media habits, the brands, the people, the lifestyle, and then lastly, the channels, the best way to then communicate with them. We then move on to Household Acorn. So this is another segmentation tool, but then at an address level. So typically Acorn is at postcode level. That's about 15 to 20 households, and you say the dominant community is that 18. With Household Acorn, it goes up one step further and looks at each